Today I'm talking about one of our projects, which is developing a social emotional wellbeing program for Aboriginal and Torres Strait Islander people in prison. This was a MRFF funded grant, but I'll tell you more about that as we go through. Firstly, the slide's working. I want to acknowledge the Gadigal people of the Eora Nation, and who are the traditional custodians of the lands upon which the Sydney University's Camperdown campus sits, where I am today, and pay respects to elders past and present. And I want to extend those respects to all Aboriginal and Torres Strait Islander people who are on the Zoom this afternoon and the traditional custodians of all the lands that you're coming in from around Australia and possibly internationally as well, if you're zooming from Aotearoa or anywhere else. So this is the team that works on the project from day to day. The day-to-day management is really Dr. Alison Evans, who's absolutely amazing. And then we've got research assistant Anna Greger, and also research associate is Waka Waka Man, Kai Clancy, who also work on the project. A little bit more about me. So the top photo on the top left-hand side of your screen, I think it is, that's one of my grandfather and his contemporaries. This was taken around between World War I, World War II. So that's up in Bardi country or on the islands, the Sunday Islands, as they're called in sort of English language. But off the coast of Bardi country in the north there. So I try to get up there as often as I can. I started my career as an Aboriginal health worker up in the community, a trainee Aboriginal health worker, and I worked at the Broome Aboriginal Medical Service and doing my Aboriginal health worker training at the Kimberley Aboriginal Medical Service Council. After a couple of years of working in Aboriginal community control, I then moved into research and did a couple of degrees. There's a few other sort of family photos there. But yeah, it is a long way from Sydney to up to Juddington. So unfortunately, I don't get back as often as I would like. In terms of imprisonment, which is what we're talking about today, we have this ever-increasing imprisonment rate of Aboriginal and Torres Strait Islander Australians that many of you are probably aware of. But we can track this further back. You see there from 2006 through to 2024. But we can track that further back to the time of the sort of 1991 Royal Commission into Aboriginal Deaths in Custody. And there is this ever sort of increasing imprisonment. While there's been periods of that plateauing, those periods have been followed by continued increases. There are two stories happening on that graph, and what the other story is that non-Indigenous imprisonment, while there has been some increase, it has remained relatively stagnant over the same period of time. So one group of people ever increasing, the other group remaining about the same rate of imprisonment. So there is truly sort of an issue happening with this. The rate of imprisonment isn't consistent across the entire country. And so you see there on the left-hand side, you've got each of the jurisdictions, with WA having the highest rate of Aboriginal imprisonment in June 2025 in the country, followed by the Northern Territory. They're sitting around about the same rate of imprisonment, but people often have the perception that the imprisonment is much higher in the Northern Territory. It's more a function of the Aboriginal to non-Aboriginal population. So there's the proportion that Aboriginal people make up of the population in the Northern Territory is much higher, so around 35% of the total population of that jurisdiction. So while we see the rates there, what we also see in terms of absolute numbers is that New South Wales has the highest number of Aboriginal Torres Strait Islander people in prison, followed by Queensland. The reason for that is those two jurisdictions have roughly about 30% each of the total Aboriginal Torres Strait Islander population, with Sydney and Brisbane having the largest Aboriginal Torres Strait Islander populations in the country. Which is something, particularly here in Sydney, we have such a large non-Aboriginal population. There's about 5 million people live in this area. And so people don't necessarily see that there's a really large Aboriginal Torres Strait Islander population here as well. So what I would reflect on with this particular slide as well is the difference in the rate of imprisonment. Like, we could have all kinds of theories about perhaps it's a function of Aboriginal people in WA or somehow, and I'm from Western Australia originally, are somehow more sort of inclined to doing behaviours that might wind you up in prison. I would say that's not the right line of thinking. It's actually more likely to be a function of the sort of criminal justice system, the systems that are in place in Western Australia. For whatever reason, we won't go into all of them today, are more likely to result in Aboriginal people being imprisoned than other jurisdictions. So if we think of it in that context, with some systemic changes about policing and practices of sentencing and all those things, there could feasibly be a reduction of Aboriginal imprisonment. So even if we got WA, Northern Territory, to reduce their rate of imprisonment down to New South Wales's rate, it's still incredibly high, but it would be much better than the current situation. So it could result in a decrease just from those measures. So we're talking about the sort of social development of social emotional wellbeing program today, and so just looking sort of at some of the broader data. And so this is a survey both Stuart and I are involved with. And so this is looking at a particular section of that and the key differences between First Nations people and non-Indigenous. We use the term First Nations in this particular report because that seems to be the way in which the federal government and those sort of national reports are trending. I do know that it's not necessarily everybody's favourite terminology, but that's sort of why I'm switching terminology here. So in terms of substance use, well, see alcohol, high risk or possible dependent is a bit higher within this from the results of the survey for Aboriginal and non-Aboriginal. We see the same with illicit drugs. What I want to point out though is the amount of substance use, alcohol or illicit drugs, whether it be methamphetamine or opioid type I was going to say opioid type stimulants, amphetamine type stimulants and opioids. Is that the non-Aboriginal population has a very high sort of level of use as well, and so the entire prison population has the prisons have this way of collecting people who perhaps have substance use issues and mental health issues and all these kinds of things. So it's not always that good to compare the picture for Aboriginal to non-Aboriginal people within this, because the non-Aboriginal population could really do with some support as well. And certainly Stuart and his team are sort of busily working on those kinds of things. But my team's focus is more on sort of Aboriginal Torres Strait Islander health. When we sort of think about this in a social emotional wellbeing framework, it's hard to get data that would kind of tell us these things accurately. But so pulling out just a couple of key indicators of intergenerational factors. If we look at the number of people in this survey that had a parent in prison, we see a much higher proportion for Aboriginal people than we do for non-Aboriginal. We see 36 versus 16%. And in out-of-home care, where it's more than double, so about 1 in 4 Aboriginal and Torres Strait Islander people who've been to prison, according to the survey, are likely to have been in out-of-home care. And so this is a sort of intergenerational impact that we're kind of seeing, and impact from colonisation, intergenerational trauma, and all of those kinds of things that are playing through within this particular population. And we see it very clearly in the figures. So in terms of people, if they'd ever been told of they'd have some form of mental health illness, we see there is a higher proportion for Aboriginal than non-Aboriginal, but 36% is still very, very high for the non-Aboriginal population as well. So both groups really do need additional support around all of these kinds of factors, but there is a specific trend. I think we can say that there are additional intergenerational factors for Aboriginal people within this population. So those are some of the reasons why we set out the bit of work we were I'm presenting today, and that is developing a culturally based social emotional wellbeing program. So I'm going to present on some of the governance, the aims and methods. We've conducted a scoping review. We're finalising that, and hopefully that'll all be put out for publication soon. Seems to take forever, those things, but we're very close to getting to that point. And then we'll talk a bit about the primary data collection, program outline, and then the next steps. So I thought it's good with this audience. You may be familiar with this, and then when we're talking about sort of the aims and methods that we do reflect on the social emotional wellbeing sort of wheel as developed by Pat Dudgeon and co. And this is you can see there on the screen that we've got. I won't go through each segment of it. But it's a really comprehensive bit of work that Professor Dudgeon led a while back. And what's interesting is while we wrote this up through our grant application, when we did the data analysis and different things, it all kind of came back and fitted within the social emotional wellbeing wheel anyway. And that wasn't like we sort of designed it to that we do the coding to try and make the coding fit. When we did the coding, it came back to this bit of work. So it really spoke to us about how incredibly valuable this work that was done or led by Professor Dudgeon has been in this space. So the aims and methods. So governance, it is an Aboriginal-led study using qualitative, so Yarning method. So that's a method developed or just sort of I don't know if develop's quite the right word. That might be a bit controversial, but Dawn Bezerup described the yarning method, and so we're using yarning methodology as described by Bezerup and co. Project governance we have which includes the Edith Collins Centre First Nations Reference Group, which we have here where we are. We've got ethics approval from the AHMRC, or the Aboriginal Health and Medical Research Council of New South Wales, which is the peak body for Aboriginal health in New South Wales, and also WAHEC, the WA Aboriginal Health Ethics Committee, which is a committee that's attached to the Aboriginal Health Council of WA in Western Australia. So they're the two main Aboriginal ethics committees. We also have a couple of other ethics approvals as well, but the Aboriginal ones are the most important ones for us. So the aim is to understand how cultural practices are currently used as part of therapeutic programs in the community, so we can use this knowledge to inform the development of a program within prison. I sort of spoke about the methods earlier, but there's an Aboriginal lens that's been applied throughout the entire data collection and analysis of this project. So the scoping review. In total, we found this is a review where we looked at grey literature as well as a peer-reviewed published literature available on academic sort of databases. And so we wrote to every Department of Corrective Services in Canada, as well as all the departments here in Australia, and each of the jurisdictions in Canada, they call them provinces, but we have states and territories. And New Zealand or Aotearoa, it's a single corrective services system, so that was fairly more straightforward to write directly to Corrective Services New Zealand. We did do a search and we wrote to the Department of Justice for the United States, the federal government department, but there's 50 odd states. So we didn't go into depth of trying to contact every single one of their states. But so the search from the US is a bit limited. There may well be lots more programs, but we only had the resources to look at a national level. And you can see there that we found two programs that met their scoping review requirements from the USA, 8 from New Zealand, 24 in Canada, and 41 in Australia. And this was we searched for programs that were First Nations, aimed at First Nations people for in prison-based treatment for whether it be alcohol and other drugs or other sorts of issues, including sort of programs aimed at to improve social emotional wellbeing and mental health. So We found that there were 69 of the programs were Indigenous specific, and 6 were sort of multicultural and these ones were really from Aotearoa, where they have they call them bicultural programs. And so in Aotearoa, about a bit over half the prison population is Māori, and New Zealand, Aotearoa, I think, is not quite as multicultural as Australia. If you think of how white Australia is, if I can just say that how it is, it really is still. If you visit, it comes across that people either are Māori or Pākehā, and there's not. There's a growing diversity, and I'll probably get in trouble for saying this from somebody somewhere, but it's not quite as diverse. So they do talk about their programs in prison as being bicultural. So it's with both Pākehā or sort of European New Zealanders and Maori people. And those were those 6 sort of programs that we found that were for both. They were mainly targeted at men, and so with men being about 9 out of 10 of the prison population, although I think Aboriginal women are the most over-imprisoned group of women in the world and make up a sort of higher proportion than the sort of 10%, I think, sitting around 12 or 13%. I can't think of the top of my mind exactly, but they're slightly higher, but about 90% of the prison population tends to be male. Traditional culture, education, and Western models were kind of what we found. So, so some of the programs really were based upon sort of long-standing traditional ways of healing, and some programs were adapted from sort of Western model. Most Western models were kind of adapted to become more Indigenous as well. And so there's a combination of those sort of 2 things with the programs we found. So most programs were group, and we were searching for group behavioural treatment programs, but some of the programs also had one-to-one counselling as part of the program as well. So you do group work and then also have one-to-one sessions with the facilitators as part of the program. Programs are co-facilitated or exclusively facilitated by Indigenous peoples. So some of the programs were only sort of First Nations people facilitating them, others were co-facilitated. And you can imagine with some of the sort of bicultural programs in Aotearoa, there's co-facilitation with some of those programs was part of how they were delivered. And so this is kind of interesting with this, because when you look at prison-based behavioural programs, often the most blunt measure that programs are sort of judged by is whether people reoffend and return to prison. But a lot of these programs were actually looking at more sort of broader measures and looking at social emotional wellbeing and those sort of improvements in health and wellbeing as well. Not all the programs, we were not able to get sort of a full evaluation of all of the programs. Some of them we got a description, and so where we've landed on that is we're sort of publishing 2 reviews. One will be a sort of a mapping review that will outline all of the programs we found and describe those. The other one will be more of a what you'd call a sort of systematic review, where we then sort of look at the data of the evaluations, and so you'll get more of an inside look at those. So yeah, one overall comment is that we weren't able to find a lot of evaluations of a lot of the programs, which they weren't provided to us, which would be really, really helpful to have that kind of information and share that kind of information in future. So we did a series of interviews with health professionals, and we've got quite a large data set from these interviews, and today I'm just going to look at 2 of the questions. So looking at how were cultural practices used as part of therapeutic programs in the community, and looking at how that knowledge could be used to develop a program for in-prison use. As I said, there's a bunch more data, but we're just presenting on this slice of it today. So looking at the participants, there were 4 sites, including over there in Perth, and also in Broome, here in Sydney, and then up in the Central Coast, which is not far from Sydney. It's kind of between Sydney and Newcastle. All in all, we had 27 participants and interviewed both men and women. These were all people who had experience working with Aboriginal people who've been to prison. They had, one of the criteria was you had to have experience of working with that group within like the first 12 months of them being released from prison as well. So they were quite familiar and worked with people coming from prison on a day-to-day basis. So some of the key findings, which we came into the themes of the cultural ways of working, and the data is sort of telling us that needed to be client-led. Space and structure were incredibly important. Trust and rapport building were critical to the therapeutic relationship, as well as strengths-based activities and sort of working cultural principles. So client-led approach. So we were told that it really needs to, when you're doing this kind of work, you really needs to be appropriate to the client's needs and to have a discussion with the client about what it is they want to achieve during any sort of therapeutic sessions. So as by way of example, I mean, the worst, as one participant said, the worst thing you could do is somebody comes in and you say, oh, so you've got a drug and alcohol problem, I see. So you're here for counselling on your drug use issues. And that was not sort of a kind of a good way to start off a therapeutic session. It was more like, oh, look, you've come in, you've been asked to sort of see us after you come out of prison. So what are the sorts of things you think you might want to work on during our sessions as we go forward? And having that sort of gentler sort of client-led approach is critical. Strategies needed to overcome issues related to alcohol and other drug use, of course, and also trauma, and multiple different kinds of trauma. So people sometimes are intergenerationally members of the stolen generation. We see an overrepresentation of that particular group within the prison system as well. So of the Aboriginal Torres Strait Islander people in prison, a large proportion either are members of the stolen generation or are intergenerationally members of the stolen generation, and perhaps showing just how incredibly traumatic the trauma that particular group has faced, as well as a whole range of other traumas. So needing strategies around how do you work and overcome those issues was critical. So I do have some verbatim. I can read it. I'm not that good at storytelling reading, but I'll give it a go if you like. But yeah, you've got Ian, and these are pseudonyms. I think that if you're able to practice deep listening with Aboriginal people, understanding historic legacies is very important. Understanding how this is tied to the land and how that is tied to the self. So this is a good example of some of the sort of data we grouped into, sort of coded into that particular theme. And so people spoke about sort of historical legacies, which often are sort of more contemporary legacies as well, but around, I mentioned the stolen generation and the legacy of the stolen gen, and how these things affect us today. Dispossession of land and sort of forcing people to relocate and those things. Now, these are all subjects that are not covered in the sort of mainstream drug and alcohol treatment programs that people may actually enroll into in prisons at this point in time. So this is sort of unique sort of stuff that we would be doing for Aboriginal people. Space and structure. So client-led approaches to picking the environment was incredibly important. I don't know if I need to explain that too much, but they spoke about the setting and so because the guys had come from prison to the drug and alcohol services, but sort of understanding that there's a difference between sort of formalities or the structures of the prison and the community service was something. But it's something we need to be mindful of moving forward is to ensure that people, as much as possible, they feel like that it's not overly regulated and those things, like a prison environment, so people should be able to set their own rules, those kinds of things for group programs. Mindful of the environment, which is relates to the top, but the natural lighting, colours, and all those things of the environment, and that can change on a day-to-day basis. So you might say you're going to do something in a particular room, and it could just be one day that light's really good, and the next day it's not so good. But so it's an ongoing kind of thing to be mindful of as you do the work with clients. Trust and rapport building. This is really, really important. Something that almost everybody said is the worst thing you could do is spend time filling out your referral forms at the beginning of the thing and sitting there and say, you've got to fill out some forms. You should just say hello and talk to people at the beginning rather than doing all that sort of paperwork. So people said that their clients really appreciated some lived experience, and so having within professional sort of boundaries, sharing a bit about themselves, and all of the people we interviewed were Aboriginal, Torres Strait Islander, drug and alcohol workers. So most of us have some level of personal experience that maybe oneself or members of the family may have had some sort of alcohol or drug use issue, or experience of family members having been to prison. That was really important. But as I said about sharing within professional boundaries, and this is a bit of a line that got to be quite careful with. So just giving you an example, perhaps say if you've got kids or nieces that may play netball, you could talk about you might talk about sports and kids' sports, but you wouldn't necessarily then talk about specifically exactly which teams your family play in and those kinds of things. So sort of staying in the subject, but being a bit vague about the specifics when sort of connecting with people. So I don't know if that's a good example, but that's one I could think of at this point in time. So you've got this from Emma, this is a pseudonym as well. So I think you need to really build a rapport with them. A lot of people are quick to sit down with the paperwork and fill out referrals. I think you really need to walk the path with them. And that comes back to sort of almost everybody said the same thing about the paperwork, is don't let that be the priority the first time you meet somebody, and just have a yarn with people and get to know them. In terms of strength-based activities, post-release support and healing programs, so talking to people about where they can go. So as the experience of some of the people we interviewed, that not everybody knew what services and things there were out there for Aboriginal people leaving custody. Focusing on the client's strengths and their achievements. And not using comparisons. So say if somebody has done, I don't know, like a barista course, that might be the best thing they've ever done, and that should be celebrated. And the last thing you want to do is say, oh, well, that's really good, but I have a master's of public health or something like it, to just celebrate that person's achievement in its own right without using comparisons or anything, and have that sort of client strengths approach. So examples of sort of activities is skills around sort of transiting from prison to AOD treatment back to the community. Spoke a little bit about that and where to find programs, parenting and support. Talk about who can help. Like that's a difficult one, but you can try and approach that from a strengths-based sort of perspective as well. And cultural connection. So talking to people about where language groups and music, both contemporary music and sort of traditional music as well. But helping people re-establish a cultural connection is a big part of what the participants in this told us we should be aiming to do with our program. Cultural principles, Aboriginal-led facilitation, but it should be a non-judgmental environment. Aboriginal-led facilitation didn't necessarily mean only Aboriginal, so it could be co-facilitated, but the lead facilitator should be an Aboriginal person as well as recommended. Having coffee or tea or food while yarning, while having the sessions was seen as really important. Doing a cultural activity while yarning. One of the women we interviewed, she would just start weaving with her clients, and she said she didn't even really tell them that she's doing that, but the clients would just kind of pick the stuff up and start just weaving while she's weaving. And then they'd just start doing these things together, which I thought was really, it's really quite, a good way of doing things. But so having some sort of cultural activity or something while you're doing sessions would be is recommended. So moving on to the next research question, or question 2 for this, connection to culture, spirit, and the dreaming. So the main themes we came through are personal and family health, as well as education, behavior change, and cultural activities, which we just mentioned a moment ago. But we sort of analysed or came up with a sort of theme around that and worked that together. So personal and family health. So ensuring when you're doing this work to be talking about physical and mental health and the connection between the both. So of course, the definition of Aboriginal health is not just the absence of the disease, but the entire social, cultural, and emotional and physical well-being of the individual. And it's a much more holistic definition of what is health. And so this came through with what we found as well. Family and intimate partner relationships and parenting were really important things to speak about. We did a bit of a search around what are some of the resources around sort of interpersonal relationships, including interpersonal violence with family, with intimate partners. And there's a real there's an issue within that space, or no, I shouldn't say an issue. There's a need within that to perhaps have more broader sort of material is what we found. So almost everything we found was sort of depicting male partners being violent and aggressive, which often but may be the case. But there was nothing around, say, if it was the same sex, if your partner, you're a male and your partner was a male as well. And there were just a number of other things that became when we put that together that we thought, oh, probably time to have a bit more of a broader sort of available kinds of resources in that space. And talking about parenting and other issues were also important. Family-friendly programs. So what we're developing is for in prison, but this came through as a really strong sort of thing that you need to be really family-friendly and be prepared for people to bring in the kids and all of the kids and the whole family to turn up and that kind of stuff. Family-led decision-making. So, I mean, this isn't a universal thing for absolutely everybody, but it came through with with our data. And that was at times you need to have a sort of family-led decision-making around how to sort of proceed with some of these sort of programs, or some of the programs, how to work through some of the drug and alcohol and other issues people may be dealing with. I jumped ahead just a moment ago. So family and domestic violence is something that did come up as something that should be spoken about. What I'll say while we're talking about this for the second time was that there was a strong indication that leading off with conversation, if this was something of concern with clients, leading off with that as a conversation is not a winner, and often men have been portrayed so often as being the aggressor or the violent person that it kind of would just tune people out. So if you just said we talk about this more broadly, but it just was not a conversation winner to start down the line of one of men being a problem group. So a bit more work on that space. I know that might be a bit controversial, and that most of the time it probably is. If there is actual violence, it's probably sort of from the male side. But starting the conversation at that point wasn't necessarily seen as a winning way to do that. Education and behavioural change. So education and day-to-day living skills. This was really important. So some of the people that were coming through the system have seen this pop up in a number of other bits of data is just things like having your ID documents. If you're familiar with this population, that can be a real issue. Literacy is an issue. Computer skills, telling people you can find it on the internet means absolutely nothing unless you know how to use the internet or you have access to a computer at most sort of in the first instance. Budgeting and those types of things, as well as vocational planning and sort of planning around work and stuff, which is a real challenge if your family, if you sort of may be in a situation where your parents didn't work either, because of the Western economy is not necessarily the best thing for Aboriginal people, where we've been forced into a Western economy that hasn't always, doesn't meet our needs. So yeah, there's some really basic, no, I shouldn't say basic, but some stuff that really practical stuff needed to be in there as well. AOD harm reduction, of course, was another key factor. I won't go into the AOD harm reduction too much. I think I'm talking a little bit too much, and we should allow some time for questions at the end. It's not, as we've got Trent, this is another pseudonym, it's not just, people with diplomas telling people with addiction how it is. It's people with lived experience that practice the program on the daily, showing other people the way, And so when doing this kind of work, it was really important. A lot of the quite a few of the people we interviewed had lived experience as well, but often people seeing people who had made the change was if seeing is believing, but that's part of the story. And so we've ended up sort of in the thing where, as we plan towards a pilot and a potential rollout, possibility of co-facilitation with people who are also in prison themselves or inmates is something that we really want to look toward as we move forward. Cultural activities. I sort of spoke about this a while ago. Not all of these are going to be practical within a prison-based setting. These were the main things that came up from our interviews. And most were discussed around yarning circles, on country learning, song and dance, and arts and craft. Different kinds of arts craft might not be possible within the prison, but certainly hopefully it's depending upon the security classification. We'll touch on that soon about painting and those kinds of things should hopefully be possible. Song and dance, one of the guys spoke about, he helped when he was actually inmate himself. He would sort of teach song and use the clapsticks and things like that. And he said the guys really sort of engaged with him when he was doing that. So not all of those are sort of possible. The cultural activities like going out hunting and fishing, those things aren't that practical for all prison classifications, of course. But certainly we've come up with some cooking activities and things that might be incorporated into what we do. There were practical considerations. This came through from the interviews, but it's also come through from the Delphi study as well as sort of other data sources that we know, and that is proper funding. Was number one off the list. So there's so many sort of pilot programs. I think Aboriginal people are sick of hearing about pilot programs. I was talking about piloting the program and then hopefully rolling it out, which is a little bit different, but where you get pilot funding, but ongoing recurrent funding was something that would be needed to go forward. More First Nations staff, of course, was critical. Connecting with rehab, so people going from prison to residential rehab. Some of the rehabs have quite long waiting lists, so it's quite hard to get in. To line it up from when people come out to go directly to the rehab is a challenge. Suggested to have a shirt or clothing or something tied to the program. I had one of my Sydney Uni shirts on today. So I don't know quite what the thing is, but I certainly do it myself with having shirts and stuff with particular events, and so that was suggested for this program. Cultural activities need to be appropriate to the traditional lands upon the prison where the prison sits. So this was so within prison you could have people from all kinds, have Aboriginal people from many different nations, and some people themselves are from, their dad might be Bardi, their mum might be Noongar or something. So the way in which when we worked through this was that the best way forward would be to make it the activities based upon the traditional lands where the prison is. So say if it was based in Perth, it would be traditional activities based upon Noongar culture. And so if it was here, a prison here in Sydney, in Gadigal, Eora, it'd be activities based upon Eora Nation, rather than trying to have a specific activity for to account for every single nation. So that's how we move forward with that. And a flexible format to suit prison security levels. So we have a heap of different security levels. Of course, group treatment programs are not really possible in maximum security because they're not really meant to be in groups, but you've got medium and minimum security. You can have group activities with people in those security classifications. So you need to do the program appropriate to different classifications. Program participation by Indigenous and non-Indigenous clients. This was quite important, where some of the non-Indigenous inmates, people in prison, they might have Aboriginal children, and those inmates in particular who have Aboriginal families should not be excluded from any Aboriginal programs or activities at all. They should be free to participate in that. And then some non-Aboriginal people in prison may have grown up in Aboriginal families as well, and they should be allowed to participate, as well as other people who might want to participate. So we landed at that spot where we would be recommending majority Aboriginal Torres Strait Islander participation in the group, but people who might sort of say they've got Aboriginal family or something, they'd be welcome to participate as well. So there's another student, is Dennis, who's speaking here. He's saying, I think that if I was to implement a program in there, I think it's going to be adapted almost all blackfellow way, you know. I mean, I don't think sitting in a classroom teaching this stuff's ever going to work. And so we got a lot of feedback, like from Dennis there, about having more a yarning circle sort of format of how we do this, and being less reliant on, say, I don't know, PowerPoint sort of presentations and those kinds of things, and doing more role plays and those kinds of things instead. So in summary from the presentation, so we found client-led approaches to understand and work through underlying issues. Relationship and trust are trust building a key. Importance of connection to culture, family, community, spirituality, and emotions. What we do need to do is further research into understanding what inmates want to learn themselves. We have some of that from my PhD, but that was a little while ago now, almost 10 years ago, that bit of work was done. So it'd be good to update some of that as we move forward as well. Next steps are developing program of lesson plans. That's been completed. We have 11 fully formed sessions, but we're going to package it as a 10 session. But we've got about 15 different sessions, but not all of them are in the current package. We're doing a Delphi study, looking for consensus on the program. The Delphi study is now being completed as well. And so we're now moving to having a yarning circle with young people to focus test. We said we'd initially focus test the program, and this was from the MRFF grant, what was in there. But what we're going to do as well is to pilot the program in 26, 27. We're sort of having a yarn with Corrective Services in New South Wales about that. I feel I shouldn't have said that, but yeah, with a Corrective Services department, and maybe more than one as well. So hopefully we might be piloting it in one or two other places as we go forward. There's still a long way to go, I have to say. So once we pilot it, we would revise, change and do things, and so. But we've kind of got a like what you might call a base model right now that then needs to be further worked on. This is a little bit old now, but that's just a look at the lesson plan, and you've got the 10 sessions that are listed there. So yeah, we do have a couple of other sessions, including on one that's really important. I mean, they're all very important, but dealing with grief is something that happens. And so you can be in prison and somebody passes away and you may not be able to go to the funeral. How do you work through some of that as well? And so that was something that came through very strongly. And so as we expand this, there'll be additional sessions, including a particular session around that. So I want to acknowledge the chief investigators. I won't name everybody, but you're over there in Perth, so I will name Dr. or I think Associate Professor now, Robin Williams at Curtin University is amazing, as well as the other chief investigators. And there's the associate investigators, as well as program partners who are the Glen Centre up on the Central Coast, in New South Wales, Millie Ramara and Broome, Wanjaning in Perth as well. And the research team again, who are amazing. And this was funded through the MRFF. So that's me. I've almost spoken for the entire time, and I don't know if anybody has any questions or if you're ready to go get out of here, maybe after listening to me talk for so long. So.
Thank you so much, Michael, for a fantastic presentation and congratulations on a really important body of work. If you don't mind just unsharing your screens and we have time for maybe one or two questions. And if people are happy to put their camera on, it's nice to see some faces. Robert, you're first.
Great. Thank you very much. Hey, Michael, that's a really great presentation with a lot of invaluable information. So thank you very much for that. So I just had to step out quickly, so I might have missed this. You might have covered it. So this is basically an overview of what things work in terms of best practices for programs for First Nations peoples.
Not quite, but kind of. So this is what I reported on the what when we interviewed people about what their experience worked best.
Right.
So yes, it is from an more Aboriginal drug and alcohol worker perspective. These aren't interviews with, say, psychologists who might be working in the prison system as per se. And so I sort of talking about there being a bit of a few more steps to go, including having what we developed sort of reviewed. We want an Aboriginal psychologist, of course, or two to review the program. Rather than a non-Aboriginal psychologist. So you kind of, a bit of it, yes, but not 100%. Does that make sense?
Yeah. I'm just thinking in terms of the research I'm doing about like looking at programs and initiatives that'll help to keep First Nations Australian men out of prisons. I think this is really invaluable research that could be applied to evaluating existing programs and to formulating new programs. So that's really wonderful. Thank you very much.
Yeah. Thanks, Rob. I'll lean into that for a sec and sort of something that I'm becoming more concerned with is around looking for individual solutions to systemic changes or systemic problems. And so while what we're looking at here is a social emotional wellbeing program, which is looking at an individual and how do we get the individual to be better, the overall decrease in imprisonment, if you remember back to the very first slides, there is a systemic problem, and those systemic problems need to be addressed as well. And this is something you and I, Rob, have talked about quite a lot. And so we do need to make sure if we want a reduction of imprisonment, we do need to keep on talking about systemic problems as well.